My name is Dr. Najjemba Aminah Sembatya from Uganda. I am a consultant obstetrician and gynecologist at the County National Referral Hospital. First of all, if I'm allowed, I need to talk about our burden of infertility in Uganda, because we have a burden of about 6.4 percent prevalence of infertility in Uganda. So you look at about 5 million couples in Uganda being infertile. So having seen that, this getting care is also a challenge, because we have the number of trained specialists in infertility is also small in our country. We have less than 50 fertility specialists in our country. As far as the centers that offer fertility care in Uganda are concerned, we have about 6 centers in the whole of Uganda that offer fertility care, fertility treatment, and if I can be specific, IVF. Now, all these are privately owned. We are now just trying to come up to offer, government is trying to establish a fertility center in our Mulago National Specialized Women and Newborn Hospital. So it is the only facility that, and it has not yet started, it is being set up. So it leaves the common man, and who these make up the biggest burden of couples who are infertile in Uganda, still facing a challenge to access this care. So the fertility options we have in Uganda, like I said, the centers that are established, the few centers that are established are able to offer IVF, in vitro fertilization as a form of treatment of infertility in Uganda. But for a majority that come to access or to seek care from public facilities, these now the kind of care they need is regarding intrauterine pathologies as a cause of infertility. Those ones we are able to give the surgical interventions, and then we are able to improve their fertility, chances of fertility. But those that are not because of intrauterine lesions, tubal factors, then those ones will recommend IVF as a mode of treatment. So the treatment options are available, like I said earlier, IVF and those that need surgical interventions. But I believe, like I said, the public needs more awareness. It needs more awareness as far as the causes, the prevention, the management options of infertility are concerned. This would improve the uptake, and it would also help to reduce on the stigma for those mothers or for those women out there who are infertile. The general population is just starting now to get some degree of awareness about male infertility as a factor. But like I said previously, men would always send their partners to go and check themselves. Like if it's a family and we're not having babies, outside you have it will always be pointed to the woman that please go and they check you why we're not having babies. And the men would not be reaching the facilities to be evaluated. They are coming, but to a small degree compared to what we desire. So I think more sensitization is needed out there to encourage men to come as a couple to be evaluated for infertility. I am very grateful to Merck Foundation for, first of all, this opportunity. I believe with this opportunity of advanced ART training at Indira has imparted in me knowledge and skills. For the patients, I believe this will be better because I'm going to go back with the more knowledge and skills, and this will help in their care. Well, before I didn't, I had limited knowledge and skill as far as doing ultrasonography, doing follicular tracking, following up a patient who is on controlled stimulation, doing ovum pickups, hysteroscopy, and doing embryo transfers. At least we've been able to see, especially embryo transfer. The others we've had actually hands-on, but embryo transfer, at least I know now how it's done, and I know that when I go back home, I can actually do it. So these are the different techniques that I've learned, or skills that I've got from here. I would like to extend my huge appreciation to Merck Foundation and the Ministry of Health Uganda for offering me this opportunity to come and enrich myself in knowledge and skills as far as advanced ART is concerned. And I hope to take this back home and help those couples that are struggling with infertility in Uganda.